Welcome, everyone, and thank you all so much for joining us today. My name is Margaret Eaton, and I'm the National CEO for the Canadian Mental Health Association, and it's my great pleasure to welcome you here today for this really important discussion. First, some housekeeping. For today's panel, we're providing interpretation in English and French. To select the language of your preference, please click Interpretation. You'll see a globe icon from your control panel below. Then click the language that you would like to hear. Once you've selected your language, we suggest you also select Mute Original Audio from the same menu so you can hear the interpreters clearly. And if you're having a problem, please send us a message in the chat. I'd like to begin by acknowledging the Indigenous peoples of all the lands that we are on today. We do this to reaffirm our commitment and responsibility in improving relationships among nations and to improving our own understanding of local Indigenous peoples and their cultures. From coast to coast to coast, we acknowledge the ancestral and unceded territory of all the Inuit, Métis, and First Nations people who call this nation home. I'm so proud to work for the Canadian Mental Health Association and would like to acknowledge all my colleagues across the country who are joining us today. CMHA is Canada's most extensive community mental health organization, and we touch more than 330 communities across every province and one territory. We provide programs and resources that help to prevent mental health problems and illnesses, that support recovery and resilience, and enable all Canadians to flourish and thrive. We're so pleased that you've all joined us for this panel discussion on mental health. The pandemic has taken a devastating toll on all our mental health and exposed glaring gaps in our mental health care system. It seems very appropriate that we're having this conversation on World Suicide Prevention Day, when our research has shown that there's been a huge increase in suicidal thoughts during the pandemic. Our so-called mental health care system isn't really a system at all. It's a patchwork of private, hospital, and community care that is inadequate for our growing mental health care needs. But the pandemic has shown us that we can take extraordinary measures to support people in Canada. At CMHA, we are calling for a truly universal mental health care system where everyone can receive the mental health care they need and where cost is never a barrier to care, no matter where you live and no matter who you are. To make that happen, we believe that all governments need to provide significant and increased resources to address mental health in communities. This is a once-in-a-generation opportunity to make meaningful and lasting reforms for mental health. Now is the time for the federal government to provide heightened leadership and sustained investments to close these critical gaps in our mental health care system. Today, we will hear from the 5 parties with seats in the House of Commons to learn more about how they would address the mental health care needs of Canadians. And we're delighted to be joined by André Picard, who will be moderating our panel discussion. André is a health reporter and columnist for the Globe and Mail, and he's also the author of 5 best-selling books, including his most recent investigation into long-term care, Neglected No More. André is an 8-time nominee for the National Newspaper Awards and past winner of the previous Michener Award for meritorious public service journalism. He was named Canada's first public health hero by the Canadian Public Health Association and is a champion of mental health by the Canadian Alliance on Mental Illness and Mental Health. I'm pleased to turn it over to André. André, thank you very much for joining us.
Great. Thank you very much, Margaret. It's a real privilege to be here for this very important discussion on a key topic to Canadians, their mental health. Now, the goal today is very simple. We have representatives of each party here to talk about the mental health aspects of their platforms in the hope that the audience will learn, and hopefully that will inform their decision at the ballot box on September 20th. We want to have a rich and cordial discussion and hear from all the parties. It's not a debate, it's a discussion. They'll speak in turn and very kindly and politely, I'm sure. We ask them not to speak over each other, to respect the time limits, because we have a lot of ground to cover. This is a big topic. La traduction simultanée, comme vous avez entendu, est disponible pour tout le monde. Je vous invite de nous adresser dans la langue de votre choix. Les candidats peuvent le faire aussi, mais s'il vous plaît, soyez courtois et respectueux dans cette discussion. I'm going to ask each candidate to address 4 specific areas of mental health coverage where there are persistent and sometimes glaring gaps. And we hope to hear about solutions and timelines for implementing fixes. Now, of course, this is going to all happen at a very rapid pace. We have 5 topics, 5 candidates, and not a lot of time. So it's going to be fast-paced, but we do have a sophisticated audience, so don't be afraid to get into the weeds a little bit. So without much further ado, let me introduce the candidates and of course, thank them for being here, taking a little bit of time away from their ridings to be with us today. We have, first of all, former Minister of Health, the Honourable Patty Hajdu. She's a candidate for the Liberal Party of Canada in the riding of Thunder Bay, Superior North. Welcome. Next, we have the former Member of Parliament, Todd Doherty. He's a candidate for the Conservative Party of Canada in the riding of Cariboo, Prince George in British Columbia. Next, we have Don Davies. He's the former health critic for the New Democratic Party of Canada, and he's also a candidate for re-election in the riding of Vancouver Kingsway. Nous avons aussi avec nous aujourd'hui l'ancien député Luc Thériault, qui est candidat pour le Bloc Québécois dans la circonscription de Montcalm. Bienvenue, M. Thériault. Et finalement, Dr. Jennifer Purdy, who is a candidate for the Green Party of Canada in the riding of Kanata, Carleton. So let me dive right into the first question. I apologize for those brief introductions, but we want to hear from you and not about you. So I want to start, the first question is a very general one where I want to get a sense of your party's vision for how to fix we know a lot of shortcomings in mental health care. So we know that Canada has a free and universal healthcare system, but mental health is kind of forgotten. It's often described as the orphan of our health system. It's not covered, it's not necessarily deemed medically necessary under the Canada Health Act, the law that sets the standards for what's covered. So when Canadians need access to mental health services, the options available to them are often very poor. To wait on long wait lists for public services, to pay out of pocket for private services, to use employment benefit plans, which often have limits on coverage, to forego services. None of these are good choices. Some people turn to their family doctors, increasingly to emergency departments to get care when they're desperate. So what I want to ask each of the candidates is, if elected, what would you do to make mental health services more accessible to Canadians? And I'm going to start in the order I introduce people. So I'll start with Ms. Hajdu. If you could start us off. And at about a minute, I'm going to cut you off.
Okay, well, that's fair notice. Thank you so much. I will waste a second to thank you for all your work on the social determinants of health and tell you I've been a fangirl for a long time prior to politics and public health. Listen, this is a focus that the Liberal government has had even prior to the pandemic, and a re-elected Liberal government would ensure a dedicated transfer, the Canada Mental Health Transfer, with up to $4.5 billion to provinces and territories over the first 5 years, with an effort to update the Canada Health Act to ensure that mental health was now scoped into what we would consider public universal health care. And I have to say, through the pandemic, we didn't let jurisdictional splits sort of get in the way of providing better health care, better mental health care to people across this country. And I think one of the things that happened early on was the launch of wellnesstogether.ca, muirspace.ca. That was something that, for me, was very, very important, that we were able to get mental health supports to people, regardless of their coverage, regardless of what their services were available through work, immediately, with no questions asked. And in fact, that portal has served 1.2 million Canadians. In fact, people in my own family have accessed private, I wouldn't say private, but confidential care through Wellness.
Well, thank you for that introductory remarks. We're going to keep it fast paced. So I want to call on Mr. Doherty to talk to us about the Conservative platform.
Thank you, Andre. It's really good to be here on World Suicide Prevention Day. Anytime that we're having this high level discussion on mental health and well-being of Canadians, it is so important. Let's be very clear. There is no health without mental health. And mental health shouldn't be a partisan subject, but it becomes a partisan subject when Canadians continue to die, whether by addictions or mental health challenges. The very real reality is this, is that the resources that are spent have not been going to the areas that are needed. Canadians are struggling. The last 18 months have been challenging for all. Increased isolation, anxiety. We know that suicide is the #1 killer of our young children in Canada. We have an ever-increasing opioid crisis. Conservatives are willing and ready to make historic investments in our mental health. $60 billion to our provinces over the next 10 years, implementing the Canada Mental Health
Thank you for that. Thank you for that great overview, and we'll come back to a few of those topics that you mentioned a little later in more depth. So I want to turn next to Mr. Davies.
Thank you. Well, fundamentally, New Democrats believe that we must treat mental health just as we do physical health. That's why this election, we propose to bring mental health treatment under the umbrella of our public health care system. As a first step, we will extend coverage to all uninsured Canadians with a view to universal coverage for all. Our universal public pharmacare plan will also mean that prescription medication for mental health care will be available to all, free of financial cost. We submit that we must treat the mental health challenge of addiction as a health issue. That means full decriminalization and access to treatment on demand. So we need to invest in the healthcare architecture to provide.
I think we're having a little trouble with your sound, Mr. Davies. I'm not hearing you.
To work with our Indigenous leadership partners to create an Indigenous mental health strategy to combat the appalling trauma that is so deeply felt by so many First Nations today. We also believe we need strong public education to combat stigma. And finally, we will invest increased public dollars to support research, especially, I think, into the mental health challenges faced by women and youth in Canada.
Great, thank you. And again, we'll come back to some of those topics. I'm glad they were raised. Monsieur Thériault, je vous passe le micro.
Alors, d'entrée de jeu, je rappelle que les soins de santé sont une compétence exclusive du Québec et des provinces. Pour ça, qu'il est primordial de se rallier au Front commun du Québec et des provinces pour augmenter les transferts de 22 à 35 %, soit 28 milliards de marge de manœuvre dès maintenant, pour ensuite les indexer à 6 % pour couvrir les coûts de système. Le problème, c'est le manque de ressources. Les gens sur le terrain savent quoi faire. Le fédéral a coupé dans les transferts. Les experts parlent même de sous-financement chronique pendant que les coûts de système explosaient dû au vieillissement de la population, nouvelles technologies, médicaments. Le fédéral pelletait son déficit dans le cours des provinces et coupait les transferts. Les besoins en santé mentale sont criants, d'autant plus que ça a toujours été le parent pauvre des systèmes de santé. Ce que promettent les partis fédéraux présentement dans les plateformes, c'est des peanuts par rapport aux besoins et beaucoup d'ingérence. C'est pour ça qu'il faut se rallier au Front commun pour une augmentation substantielle des transferts pour prendre soin de notre monde en santé mentale.
Merci beaucoup pour votre breveté. Merci. Dr. Purdy, I turn the floor over to you. Thanks.
Great, thank you very much. So the Green Party, we believe in working together, and obviously we would work with all other parties on this important issue because, as has been mentioned, we are missing basically everything. Mental health is physical health, and right now we're not doing a good job with mental health. So what do we want to do? Pharmacare is often, medications are often part of the solution for mental health issues. And we are also a big fan. We want pharmacare to become part of the Canada Health Act. We also want to establish national mental health strategy, including a suicide prevention strategy for across the country, because obviously there are issues. And then we want to negotiate the Canada Health Accord to prioritize the expansion of mental health and rehab services. We obviously need to work with the provinces. The provinces need a lot more funding. The funding's been neglected for a couple of decades. And that's how you can get more doctors, more nurses, social workers, psychotherapists into university to get trained up to do these important professions.
Great, and thank you. And thank you to everyone bringing up a lot of rich topics. And I want to wade into a couple of them in more depth because there's great interest from our audience. I'll just notify the candidates that the order for the next questions, I just randomly picked your names out of a hat, so you'll be in random order. Mr. Doherty, I'm going to ask you to speak first on this question, so I'll give you a little bit of advance notice. But I want to talk about the opioid crisis. I think most of the candidates mentioned this in their opening policy platforms. The opioids crisis has really worsened during the pandemic, and it's made evident the reality that many people who use substances lack access to treatment, they lack access to support to survive and to thrive. They also face significant challenges due to stigma, criminalization, and structural and racial inequalities. So if elected, I'd like to know what your parties would do. What policy solutions or investments would you make to support the health and safety of people who use substances? So Mr. Doherty, the floor is yours for about a minute.
Thank you. Well, first, what an elected Conservative government would do with the opioid crisis is declare it what it is, a national health emergency crisis. Every day, 17 Canadians die from opioid-related deaths. Since COVID-19, opioid-related deaths have almost doubled. An elected Conservative government will invest $325 million in our first 3 years to create over 1,000 residential drug treatment beds and build 50 recovery community centers across our country. We're going to enhance the delivery of culturally appropriate addiction treatments and prevention services in First Nations communities with high needs. We're providing $1 billion over 5 years to boost funding for Indigenous mental health and drug treatment programs. And we're going to partner with the provinces to ensure naloxone kits are available free across Canada. Moreover, we're going to work with our Indigenous communities to create culturally sensitive land-based treatment centers so that we can once and for all deal with the intergenerational trauma that our Indigenous communities are facing.
Great, thank you. Monsieur Thériault, sur la question des opioïdes et l'utilisation des substances, c'est quoi les solutions proposées par le Bloc québécois?
Merci. En criminologie, il y a une approche qu'on appelle la réduction des méfaits. Le Bloc québécois préconise la réduction des méfaits pour faire face à la crise des opioïdes. Et en ce sens, la déjudiciarisation est une avenue à emprunter. On souhaite que les gens qui sont arrêtés pour possession simple soient accompagnés par des mesures de soutien ou de sensibilisation plutôt que poursuivis. Comme cela, on évite la criminalisation. Ça permettrait donc d'alléger la pression sur le système de justice, mais surtout de déceler les cas problématiques plus tôt, faire de la prévention. On souhaite que le problème de la consommation de drogue, au fond, soit traité davantage comme un problème de santé publique qu'un problème de criminalité. Évidemment, pour financer les services d'accompagnement et de soins en santé mentale, il faut augmenter substantiellement, dès maintenant, les transferts en santé.
Merci beaucoup. Mr. Davies, on the drug use opioids crisis, what is the NDP proposing? And I think I see Mr. Davies frozen, so I'm going to skip over him and come back. But are you ready? Okay, I see your screen's working now, so please go ahead. Thanks.
Thanks. Well, I think it's important to identify the root cause of much of the problem, and that's Canada's escalating overdose crisis has been fueled by decades of failed drug policy, and it's time for a new approach. You know, Canadian communities from coast to coast have been devastated by the overdose crisis. We've lost over 20,000 loved ones in the last 5 years alone, and we've witnessed a dramatic spike in overdose deaths throughout the COVID-19 pandemic. So Canada must mobilize an emergency response to this public health crisis. I think it's the second pandemic in this country. So to save lives, a new Democrat government will do the following. We'll immediately declare a public health emergency. We'll end the criminalization and stigmatization of people who use drugs, and finally treat it comprehensively as the health issue that it really is. We will expunge criminal records for personal possession to help end ongoing stigma. We'll ensure a low barrier, regulated, safe supply. We'll expand access to harm reduction, treatment, and recovery services across Canada. We got to build the healthcare architecture to allow treatment on demand. And finally, we'll launch an investigation into the role that pharmaceutical companies played in this crisis and seek reparations to help pay for treatment, just like the US federal government and many US states have done, recovering billions of dollars to the public treasury to fund the treatment, prevention, and education that we need to address this ongoing problem.
Thank you. Thank you for that answer. Obviously a big issue in your riding in Vancouver specifically, so thanks. Next, Ms. Hajdu, please.
Well, thanks very much. Listen, the proof is in the pudding. The Liberal platform has costed out the spending that we propose on specifically the opioid crisis and problematic substance use. And we're proposing 625 million, and the Conservatives are proposing 325 million. So you put your money where your mouth is, and that's what this government has done consistently. We're going to continue to do that. It's about making sure that there are standards, but it's also about prevention. It's about the poverty reduction that we've been pursuing with things like the Canada Child Benefit. It's about a national child care plan that provides dedicated quality spaces for $10 a day. We know that those early years really matter in terms of people's outcomes. It's also about making sure that we have a variety of substance use programs and supports in communities through things like the substance use and addictions program funding that goes directly to communities for things like safer supply right in BC, for example, and across the country. And we'll work with provinces and territories to make sure that we can expand access to safer supply. It's disappointing to see so many Conservative premiers stand opposed to these life-saving treatments.
Great, thank you. And finally, on this question, Dr. Purdy, the Green Party stand on opioids, crisis, on decriminalization, et cetera.
Yeah, so the Green Party, we take an evidence-based approach, and it is regrettable. Mayors across the country and public health officials have been asking and pleading with the Liberal government to decriminalize drugs for a few years now because of the opioid poisoning crisis, and it has not yet occurred. That is not an evidence-based approach. So obviously the Greens, what we want to do, and we will work with other parties to do so, is to declare it a national public health emergency, to decriminalize possession of all illicit drugs for personal use, create a national safe supply of drugs of choice, because it's the unsafe supply that is killing people right now. But then also investing in an integrated system of decriminalizing and access to meaningful services for people who are seeking treatment. So when they're ready to seek treatment, treatment must be available and it must be accessible. Right now, it's tens of thousands of dollars. So we need, what we've been doing hasn't been working, and it's taken a very long time for us to realize that and change directions. Then, of course, we also want to have amnesty for people convicted of simple possession of cannabis, and we also want to make sure that naloxone is freely and widely available for those who may need it or be at risk of an overdose.
Great, thank you. And I want to thank the candidates again for being very brief and on point and having very rich answers to the question. I think it's serving our audience very well based on what's being said in the chat. People are appreciating it, so thank you. Alors, j'aimerais aussi demander une question en français. Évidemment, si vous avez besoin de vos traductions, la traduction simultanée est disponible. Alors, beaucoup de gens ne considèrent pas le logement comme un problème de santé mentale, mais l'accès à un logement sûr et abordable est l'une des conditions préalables les plus importantes à la santé. Un déterminant social crucial de la santé est le logement supervisé et abordable, qui garantit aux personnes atteintes de maladies mentales et de problèmes de toxicomanie un endroit sûr où vivre pendant leur établissement. S'il est élu, que fera votre parti pour élargir le logement-service et abordable au Canada? Et cette question, j'aimerais commencer avec M. Davies. Vous êtes évidemment bienvenu de parler en anglais ou en français, c'est votre choix. So, Mr. Davies, over to you, please.
Sorry, we're talking about housing?
Yes, we're talking about the housing question. I could repeat it in English if you like, but...
No, that's okay. I think I got it.
I think we're having a little trouble with your sound again.
Community and ability to access support structures. And
Mr. Davies, can I stop you? I think I'm going to ask you to start over because we didn't have your sound there. So to be fair, I'd like you to start again if you could.
Thank you, Andre. So I think we need to fundamentally recognize and address the critical importance of social determinants of health, both physical and mental. And one of these is access to secure, decent, and affordable housing. It's essential to well-being and meaningful participation in society. We know that connection with community and ability to access support structures and services are clearly undermined when folks have to move or live in precarious.
I think we're dealing with the joys of the internet. I see Mr. Davies frozen. I don't know if others are having that issue, but...
Sorry, am I frozen?
You were frozen. We can hear you again now.
Okay.
Off and on.
I don't know where you lost me, but we'll provide dedicated fast start funds to help communities get projects off the ground immediately. And our housing strategy will include measures to support Canadians at risk of becoming homeless. We believe in adopting a housing first approach. And to help deliver help to the most vulnerable right away, we'll work with provinces and municipalities to fast track the purchase, lease, and conversion of hotels and motels for emergency housing relief until more permanent community-based solutions are available. It's time to recognize that housing is a foundational aspect, and it is critically important to not only physical but mental health outcomes.
Great, thanks. I gave you a little extra time there to try and make up for our technical woes. I hope the other candidates are fine with that. We'll do the same for others if necessary. So Dr. Purdy, if I could turn to you, thank you.
Sorry about that. So yes, housing is obviously a huge issue. We're having a crisis in Ottawa and in various parts across the country recently. So we have a very robust housing plan, but just some examples that may be a little bit more particular to the topic at hand. So we want to be reinvesting in affordable, nonprofit, cooperative, and supportive housing. We want to protect the existing stock of affordable housing because it's being taken out of the market right now. So we want to be funding the purchases of buildings by nonprofit and cooperative affordable housing organizations. We also want to expand the Rapid Housing Initiative to bring new affordable and supportive housing on stream with minimal delay. And we also want to invest in construction and operation of 50,000 supportive housing units over 10 years. And in particular for people with disabilities and special needs, we want to require that housing developments receive federal funding. They must ensure that 30% of all units in each development must be deeply affordable and or available to people with disabilities and or special needs. And just to take a slightly broader approach, guaranteed livable income, childcare, and of course, pharmacare, we need to see this as a systems-based approach. Thank you.
Great, thank you. And next, j'aimerais demander à Monsieur Thériault une intervention. Merci. Monsieur Thériault, à votre tour.
D'accord, merci beaucoup. Alors, le logement est un élément important de la réinsertion sociale. Le Québec a d'ailleurs besoin, dans les 5 prochaines années, de 50 000 nouveaux logements sociaux. Le Bloc québécois réclame que le fédéral réinvestisse progressivement en logement social jusqu'à atteindre 1% de ses revenus annuels totaux afin d'assurer un financement constant, prévisible, plutôt qu'en vertu d'ententes ponctuelles. Il faudrait aussi que toutes les propriétés excédentaires fédérales soient consacrées prioritairement au logement social et communautaire. Le Bloc propose un réaménagement financier de la stratégie nationale sur le logement pour créer un fonds d'acquisition qui permettrait aux coopératives et aux OSBL d'acquérir les immeubles dans le marché privé et d'en faire des logements sociaux communautaires. Finalement, le Québec doit recevoir sa juste part de financement, toujours sans condition, des programmes fédéraux de lutte à l'itinérance.
Merci beaucoup. Ms. Hajdu, please.
Well, thank you very much. And again, I'll just reiterate, the proof is in the pudding. So if you compare the Liberal costed budget and costed plan and the Conservative costed plan, we're proposing to spend an additional $4.5 billion between budget 2021 and $2.5 billion for rapid housing. That's on top of the $4 billion Canada housing benefit. So that's $8 billion on this problem already. And the Conservative platform proposes $2.5 billion. You know what for? To defer capital gains on rental housing, which sounds like it benefits landlords to me. It doesn't really sound like it benefits people who need housing. So our plan actually resulted in at least 3,000 new affordable units, and budget 2021 will mean another 4,500. This is for rapid housing, but the Canada housing benefit actually went directly to people with core housing need, and that was $4 billion in cost matched funding, with over 300,000 Canadians being helped to pay their rent. And you're absolutely right. You cannot get well if you do not have a safe place to live, and that's why we focus so much of our energy and attention on a national housing strategy that has many aspects, including obviously making it easier for people to enter the market.
Great, thank you. And Mr. Doherty, final intervention on this point.
Well, it's disappointing to see that the former minister has to use her talking points to talk about something that is so critically important, as well as get partisan on an issue that they have failed on. You know, every election cycle, they make these promises, and what we've seen, it's not working, and they fail to work on that. An elected Conservative government will, within our first 3 years, create 1 million homes. We will re-implement the housing first approach, which has been watered down by the federal government. We'll revise the federal government's substance abuse policy framework to make recovery its overarching goal. We'll put the resources where they're needed. You know, a roof over a head shouldn't be a privilege, it's a right. We won't take First Nations to court. We will solve the boil water advisories that this government just have failed again in their promises. You know, it's good that we're having this conversation. It's too bad that it has to be so partisan. And it seems like our minister is doing a lot of backpedaling and trying to explain and attacking instead of real action.
Great, thank you. So I want to note for the participants, thank you all for being there. We have more than 400 people tuned in. There's a lot of interest in the chat. So obviously they're paying attention to your answers. I also want to note we've posted all the platforms of the 5 parties that you can click on in the chat. Tous les programmes des partis, des 5 partis sont disponibles pour les gens avec beaucoup plus de détails que nos réponses rapides. So I want to go on to the next question. Indigenous people in Canada have really disproportionately been impacted by the pandemic. They've endured intergenerational trauma as the result of colonialism, including the legacy of residential schools, which of course has been making headlines for months now. The health disparities among Indigenous and non-Indigenous peoples in Canada are huge. So I want to know, if elected, what investments will you make to ensure that Indigenous mental health, in particular, the dealing with the intergenerational trauma that we're so aware of, is supported, and that we can use this to move towards reconciliation? And I've picked out of the hat to start this discussion, Dr. Purdy first, please.
Okay, thank you very much. And I would just like to take a second to just say that this is where overall health is so important, because it impacts mental health. So when you don't have adequate housing, when you don't have potable water, when court cases are ongoing and there's ongoing disrespect from the federal Liberal government, it's hard to be in a good place, right? And it's hard to be mentally well for many people. It just kind of it's a piling on effect. So what would the Green government what would a Green government do, and what would I do working hard towards as an MP, would be to establish increase support for Indigenous-led, because it should be Indigenous-led, culturally safe mental health programs and services, and they should be trauma-informed and rooted in Indigenous practices and healing. The programming should be guided by the First Nations Mental Wellness Continuum Framework. Also, we also want to support First Nation, Métis, and Inuit in rebuilding the traditional knowledge systems around healing and wellness. And finally, there's a bunch, if we look at the TRCC, there's many points and things that need to be completed already, both for around overall health and then also around mental health. And it's time that we actually implement these calls to action and get going on that. Thank you.
Great, thank you. Mr. Doherty, please.
You know, this is an issue that Canadians are just waking up to. And sadly, those of us that have been listening for a long time have been aware of these challenges that our First Nations have lived with. The fact that we have suicide epidemics ongoing in our First Nations communities, that we have boil water advisories, that we have housing crisis that in our First Nations communities that have been incredibly challenging. The intergenerational trauma that our First Nations have endured because of the residential school program is horrifying. An elected Conservative government will make historic investments. We will provide $1 billion over 5 years to boost funding for Indigenous mental health and drug treatment programs. We'll create culturally sensitive land-based treatment facilities working with our Indigenous communities to make sure that we can combat the intergenerational trauma that we have seen and that plagues our Indigenous communities. Moreover, we will fund the search for these children, the lost children of the residential school program. We'll develop a comprehensive plan with our Indigenous communities to implement TRC calls, Action 71 through 76. Moreover,
Thank you for that. Thank you for that detailed answer. I'm going to cut you off because of time so we can be fair to everyone. Monsieur Thériault, sur la question autochtone de santé mentale autochtone, la réconciliation, c'est quoi la position du Bloc?
Le Bloc québécois est d'avis qu'en matière de santé mentale des peuples autochtones, c'est essentiel d'avoir une approche holistique globale. Jusqu'à maintenant, l'approche utilisée a montré ses limites, puisqu'elle privilégie l'intervention individuelle sans égard aux ancrages collectifs des traumatismes intergénérationnels issus du colonialisme. Il faut faire tomber les barrières que les expériences vécues et perçues de racisme ont érigées chez les individus issus des communautés autochtones lors de leur interaction avec les systèmes de santé, en s'attaquant au racisme systémique et en offrant des services culturellement adaptés. Évidemment, c'est la prérogative du gouvernement du Québec puisque c'est lui qui offre une grande part des services sociaux destinés aux Premières Nations. Mais la Commission vient a fourni plusieurs pistes de solutions et nous faisons entièrement confiance au gouvernement québécois pour tenir compte dans son prochain plan d'action en santé mentale 2020-2025 de toutes ces recommandations-là pour voir un plan d'action et une élaboration d'un plan qui va vraiment répondre aux besoins de nos communautés autochtones.
Merci beaucoup. Ms. Hajdu, please.
Well, thanks again. And it's quite telling that the Conservative plan's only costed budget line item on Indigenous people is on Indigenous mental health, despite the fact that it does appear that Member of Parliament Doherty understands the social determinants of health and knows that indeed better housing and access to education and skills training and distinctions-based economic development all matter in terms of people's mental health outcomes. We're committing $1.4 billion for Indigenous mental health and trauma support on top of the work that we're doing on reconciliation, on equity in funding to make sure that Indigenous communities have what they need for their own self-determined programming. And let me just tell you about one of the communities in my riding, Long Lake 58, who received funding through the Choose Life program. This is in the Anishinaabe Nation. It's a suicide prevention program that was designed by Indigenous people, in fact, the community, for that community. And Chief Judy Desmoulin told me how it's the first program that she's seen in her leadership experience. It's actually worked because it was designed by the community for the community. That's the kind of distinctions-based approach that we need. I'd also just call on all candidates to stop talking about our Indigenous people. This is a nation-to-nation relationship. We don't actually control these Indigenous communities. This is about empowering those nations to make decisions that are best suited for their own outcomes.
Great, thank you. And Mr. Davies, please, on this question, Indigenous mental health.
Well, I think that Canadians have to face the appalling reality, and that is Indigenous people suffer the worst health outcomes in general of any population in Canada. You know, a shocking number of First Nations, Inuit, and Métis communities do not have access to reliable healthcare services, and this is in a G7 country in the 21st century. People cannot get the mental health care that they need. And I must say, with all due respect to my Conservative and Liberal colleagues,
I'm having trouble with your sound again.
we will work in partnership with Indigenous communities to improve access to mental health care services and treatment for problematic substance use, both on and off reserve, including an evidence-based action plan to prevent suicide backed up by dedicated federal resources. We need to provide sustainable funding to address the physical, mental, emotional, and spiritual harms caused by residential schools, and recognize that healing the ongoing trauma caused by colonialism in residential schools we have to quit fighting Indigenous children in court and apply Jordan's principle as an enshrined right and implement all of the Truth and Reconciliation Commission recommendations. We've only done 14 out of 94 to date. That is an appalling record.
Okay, thank you. And we had some sound fading in and out there with you, so we'll encourage people to read your platform for some of those details. Thank you. As we heard in the introduction, today is World Suicide Prevention Day. So I want to ask a final question about suicide. What is each of your party's position on prevention of suicide? We know that more than 3,000 Canadians a year die by their own hand. A lot of young people, a lot of Indigenous people, marginalized people. So again, I'd like to hear the party's solution to this suicide crisis. And I have Mr. Davies first in line for this one, please.
Thank you. Well, that is such a timely question, and it's been a vexing and I think highly stigmatized aspect of public health for far too long in this country. I think we all agree that mental health challenges and suicide challenges have been exacerbated by the COVID-19 crisis. And I think we all have recognized that COVID has created some problems, but it also has exposed some problems. I mean, I think, to be honest, almost everything that all the candidates have touched on today bear in some way as part of the solution to a national suicide crisis in this country. There's no one magic answer, but it involves giving people hope, and that means addressing the core social determinants of health. It means going to where people are most at risk, which in many cases are the Indigenous communities in this country. Up north, there are suicide crises that my colleague Muma Lakakak repeatedly brought to Parliament's attention. So we need to put the resources, the attention, the priority that this needs. We need to, I think, also place a lot more attention on prevention, which is in healthcare, I think, is often the ignored orphan of our system, where if we invest dollars up front, we can actually prevent these problems in the future. But it's going to take, I think, a comprehensive federal, provincial, Indigenous, and municipal approach.
Thank you for that answer.
Which I think all parties are committed to doing.
Thank you. Monsieur Thériault, sur la question de prévention de suicide, c'est quoi la solution?
Oui, s'il y avait une seule solution magique, ce serait parfait. Mais je pense qu'il y a tellement d'intervenants dans des milieux communautaires qui interviennent de façon efficace, mais qui manquent de ressources, qui manquent de financement. Vous savez, il y a des organismes communautaires qui passent souvent plus de temps dans la paperasse administrative à justifier leur mission qu'à pouvoir prendre le temps d'offrir les services. C'est pour ça qu'on insiste tant que ça sur l'augmentation dès maintenant des transferts en santé. L'état suicidaire, un état suicidaire, c'est un état réversible qui doit être réversible. Et pour ça, il ne faut pas baisser les bras et il faut que l'accessibilité aux services se fasse rapidement. Ce n'est pas sur des listes d'attente qu'on peut régler un état suicidaire. Alors, il faut absolument, dès maintenant, justement parce que la pandémie a exacerbé justement la fragilité du réseau de la santé à prendre soin du monde, il faut tout de suite essayer d'injecter de l'argent massivement pour qu'on puisse rétablir les réseaux et prendre soin des gens qui présentement sont sur des listes d'attente.
Merci. Merci pour votre réponse, pour votre intervention. Ms. Hajdu, what would the Liberal Party do to address this suicide crisis in Canada?
Well, thank you very much. And I think the one thing that probably listeners are hearing is that we all agree that the social determinants of health, things like access to education and housing and affordable, nutritious food, and all of those things really make a difference in people's outcomes, including, for example, accessible and affordable childcare that provides early years development the best chance. But I'll also say that we didn't wait to take action. We launched wellnesstogether.ca, where people can get help right away, no matter if it's in the middle of the night, no matter what the crisis is. When people are in crisis and they need to reach out, there needs to be something on the other side. We also have budgeted in our budget, and again, not to harp on this point, but we have actually costed out the cost for a national suicide prevention hotline, $40 million over 5 years, and we're just waiting for the CRTC. I want to thank Todd Doherty actually for this initiative in the House of Commons, bringing this to the House of Commons, but we did actually reach out to the CRTC for a 3-digit national suicide prevention hotline, but but we've got the money in the budget to start funding that hotline as soon as it's approved by the CRTC. So actions happening on the response side as well. And I do want to thank all my colleagues for talking so openly about mental health and wellness and crisis. I mean, we've all experienced it in our lives, whether it's our own personal lives, whether it's our families, whether it's our children or the other people that we love and care about. And the more that we can talk about this topic with openness, the more that we as leaders can do to destigmatize this conversation.
Thank you. Dr. Purdy, on the question of suicide prevention.
Yeah, so it's really important, as has been mentioned, to look at the social determinants, and then also to have things like a suicide hotline is fantastic. But we also need to take an evidence-based approach and try and start to provide more appropriate care across the country in terms of access to family doctors, and that requires funding from the federal government, which has been lagging for the last several years or decades. But we also need to have access to mental health, and so that comes back to the conversation that we were having earlier today, talking about improving access to mental health supports so that the person doesn't need the hotline in the first place, but if they do need it, it's there, which is fantastic. We also need pharmacare because antidepressants are evidence-based for a significant depression and or anxiety. Obviously we need to take a culturally sensitive approach to people across the country. And we also need to take a step back and look at the evidence, and the research that will often demonstrate why people get into a place where they have suicidal ideation in the first place. And that's not happening right now. Thank you.
Great, thank you. And finally, Mr. Doherty, the Conservative platform on suicide prevention.
Listen, I've been very open. Suicide has personally touched my life negatively. And whatever we have been doing as a nation hasn't worked. We know that 10 Canadians lose their lives every 24 hours. A further 200 attempt suicide. Those are pre-COVID numbers. And those are the stats that we know. So many go unreported. I believe my colleague, Ms. Hajdu, truly cares. Unfortunately, I don't believe it's been a priority for her government. We have to do better for Canadians. We will bring 988 to Canada once and for all. We won't rely on CRTC to do the consultations. We know that it is needed. When Canadians need help, they don't need to go to a web page. They need to have access to a bed, access to recovery, and a voice on the other line of a phone. When minutes matter, a simple 3-digit number can make the difference between life or death. We need to be better. We need to educate, and we need to, yes, deal with those social determinants to make sure that we can provide a better way of life so that children as young as 4 on our First Nations communities aren't choosing death, that they can see a brighter future. A Conservative government will put those resources where they're needed, make historic investment in our grassroots organizations, in the communities.
Thank you for that answer. I'm going to squeeze in another question just because there's a lot of interest in this in the chat and I've neglected to talk about it. So I'm going to ask you brief answers on this one, but particular interest in rural and remote communities where mental health services are just non-existent for many. How can we fix that? Each of you, if I could ask you briefly, I'll start with Dr. Purdy, if I could.
Good question. So again, yes, because access to mental health services and also even family doctors is a real challenge rurally, and we cannot also forget about like on reserves across the country, where, as one doctor said, it's like the system was set up to fail because it fails Indigenous every day, basically on reserves. Solutions that involved would be, like, to me, telemedicine has a significant role to play when people are stable. We're already doing psychotherapy and psychiatric assessments and that sort of thing very successfully in people who are stable across the country. One step towards that, for example, would be to change the college licensing system, at least for doctors, perhaps for nurses. That would also help improve access to underserviced areas across the country. And again, the federal government must invest in the provinces and territories, because that's been lagging. The funds are not reflective of the demographics and the issues we have, especially in mental health today. Thank you.
Thank you. Ms. Hajdu, please, on remote access to mental health services.
Well, thanks. And that's a big feature of the healthcare funding that we're proposing in our platform. In fact, expanding access to family doctors and primary care teams is a huge commitment, $3 billion. And it's about trying to, first of all, ensure that we attract people to rural communities and keep them by providing debt relief and loan forgiveness for people studying, not just in, by the way, healthcare, direct healthcare, physical healthcare, but in other allied professions like social work and mental health providers. But also, I'll just say the virtual care and expanding access to care in rural areas. And I do want to respect what my colleague said about, stable people doing better with virtual care. But I'll also say this, there's a stigmatization of walking in the door of your counselor when your counselor's front door is on Main Street, if you will. And we've lived this in Thunder Bay. I've lived this as someone who's worked in mental health and substance use. There's no privacy in being able to access a provider in a small community. So virtual care and the investments we've been making to expand access to care in rural areas will help with
Great.
folks that have a hard time getting
Thank
here.
you. Thank you very much. Mr. Doherty?
Yeah, I think my colleague makes a very important part. I live in a rural community as well too. We find that all the time where, if you have someone that provides the services, if you can find those services, do you want to go into those services when everybody on Main Street is going to see you walking into that area? So that's a very critical point. Listen, we need to make sure that those resources are there wherever Canadians live, whether it's rural and remote or urban. We need to make sure that the funds are available. We are going to provide $150 million over the first 3 years to grants to not-profits and charities delivering mental health and wellness programs in the communities, grassroots, which always have to worry about stable and predictable funding every year. But we will do that. We'll bring finally predictable and stable funding to our provinces and to our communities and to those organizations that are doing such incredible work but need the resources.
Great, thank you. Monsieur Thériault, comment assurer les services de santé mentaux dans les régions éloignées? Est-ce que vous avez un plan en bloc?
Oui, un plan. C'est un mot à la mode.
Oui, très.
J'allais dire que quand on parle de santé mentale, il faut pouvoir investir massivement en prévention et en promotion de la santé mentale. C'est une chose de dire qu'il faut que l'individu ait accès à la ressource, mais moi, je pense que dans les régions éloignées, il faut que la ressource se rende à l'individu. Et pour ça, il faut absolument y aller avec un réseau communautaire parce que les centres hospitaliers sont très, très loin. La dernière chose qu'on veut, c'est quand on est en détresse, c'est d'être obligé d'aller attendre à l'urgence 27 heures, là. Donc, dans ce sens-là, je dis, il faut injecter de l'argent là où les groupes communautaires, les réseaux communautaires sont installés. Par exemple, il y a eu des interventions ici au Québec au niveau des travailleurs de rang, parce qu'il y avait beaucoup de détresse et il y a encore beaucoup de détresse chez certains de nos producteurs agricoles. Encore faut-il que ces gens-là soient ouverts à aller chercher l'aide. Alors, c'est dans ce sens-là que je dis, quand on parle de santé mentale, il faut parler beaucoup de promotion de la santé mentale, de prévention de la santé mentale.
On veut laisser du temps pour finir très fort. Alors, merci. Mr. Davies, final word on this remote access to mental health services. Many people in the chat noted that, your internet coming in and out is familiar to people in these regions. How would the NDP help deal with this, make mental health care more accessible around the country?
Well, as my former colleague Nathan Cullen used to say, it appears violent agreement is breaking out. I think I've heard is part of the solution. I'm very excited about virtual care. If you'd have asked doctors 3 years ago if they would go to teleconferences and deliver care by phone, they would have said no. And now we see how explosive that has been and how access has been increased. I think we need, so I think virtual care, particularly for things like talk therapy and counseling, it is going to prove to be enormously helpful in bringing care in urban centers to rural areas. I think we have to increase the use of interdisciplinary care teams. I also think we need a national healthcare professional human resources plan. We need to plan 20, 30 years out to find out where the social workers, the counselors, the nurses' aides, the nurse practitioners, the family docs are coming from.
Great, thank you. Thank you for that contribution. We're almost out of time. The hour has flown by, but I want to give everyone an opportunity to have a final word on this. So I want to give you each a minute to give us a take-home message. What is your party going to do to make access to mental health care better? Thank you, Mr. Davies. We're going to go into the final comments, and I'm going to go in the reverse order of how we began. Seems like minutes ago, but it was an hour ago. So I'll start with Dr. Purdy, if I could. Give us the take-home message for the Greens in a minute or less.
So a take-home message is that we need to, number one, the federal government needs to start paying more money for healthcare across the country, because healthcare is, of course, delivered by the provinces and territories, with the Canada Health Act being the overarching federal document. So we need to provide, the federal government needs to provide the funding. We need pharmacare. We need enhanced access to enhanced mental health services. But the other thing too is that we're hearing today is we can't have this partisan snipping going on. We have to work together on the mental health crisis that's occurring in Canada, and then on the healthcare crisis that's occurring in Canada. So, and the other thing too is we also need a systems-based approach, and that comes down to internet. We are talking about delivering care from a distance, and I've experienced this myself. We all need better internet and affordable internet, and also guaranteed livable income, et cetera, et cetera. Thank you.
Thank you for that good pitch for the Green Party. Thank you. Monsieur Thériault, un dernier mot pour renvoyer les gens chez eux sur la santé mentale.
Écoutez, la santé mentale a toujours été le parent pauvre du financement des soins de santé. Notre système de santé était fragilisé par le sous-financement chronique avant même la pandémie. La pandémie a exacerbé les besoins en santé et en santé mentale. Et à ce titre-là, on ne peut pas attendre l'après-pandémie pour augmenter dès maintenant les transferts en santé de façon substantielle. Et substantielle, c'est à mon avis de rétablir le 35 % qui donnerait 28 milliards de marge de manœuvre au Québec et aux provinces, et ensuite rétablir la coupure que les conservateurs avaient fait d'indexer à 3 % alors que ça ne rencontrait même pas les coûts de système, pour les remettre à 6 %. C'est de ça dont on a besoin si on ne veut pas que la pandémie ait des répercussions, selon une étude anglaise de l'Angleterre, des répercussions encore pendant 10 ans sur le taux de mortalité des gens qu'on a à soigner.
Merci pour votre contribution, votre intervention. Mr. Davies, please.
You know, it's an estimated 1.6 million Canadians have an unmet mental health care need each year, and counseling is reported as the highest unmet need. With only 7.2% of our healthcare budget dedicated to mental health care, Canada spends the lowest proportion of funding on mental health among G7 countries. Places like New Zealand, Australia, and UK, funding levels range from 10 to 14%, and even that might be too low, given that mental illness represents as much as 23% of the total disease burden. Now, the hope is that research has shown that adding mental health care to our public system will not only improve outcomes and save lives, it will ultimately pay for itself. Every dollar invested covering psychological services results in $2 of savings to society. So it's time to treat mental health as the core health need it is. It's time to treat addiction as a health, not a criminal issue. And it's time to bring access to mental health care into our public healthcare system to provide universal access for everyone.
Great, thank you. Mr. Doherty, a final word?
I first want to say thank you to all of our colleagues that are on here. I think Canadians can see that we care. But what is happening is that what has been done isn't working. We need a better plan. We need to move forward, and better is always possible. An elected Conservative government will make historic investments, launching our Canada Mental Health Action Plan. We will recognize that mental health is in parity with physical health. It has to be done. We have to work with our provinces, increasing our provincial healthcare transfers by minimum of 6%. We need to work with our Indigenous communities, and we have to make sure that that care and attention is getting to Canadians when they need it, wherever they need it. Canadians deserve better, and a Conservative government will bring better.
Thank you. And final word, Ms. Hajdu.
Well, thanks very much. And I agree. The colleagues that are on this panel today are very passionate, and that's a great thing. But it takes more than passion. It takes money and commitment. And again, I just really urge voters to check out costed platforms. Really, only the Conservatives and the Liberals have costed platforms. The NDP doesn't have one as of yet. And in fact, when you look at the Conservatives' plan, they're proposing $1.35 billion over 5 years, but that's compared to our $6 billion commitment over 5 years. So we are committing dedicated money in a dedicated transfer with mental health standards across the country so Canadians can get the help they need when they need it urgently and know exactly what those standards are of care. I think we didn't get a chance to talk a lot about standards, but that standards development is underway with all provinces and territories. It's something I hear about at the door all the time in this election. And I'm really looking forward to moving forward with Canadians on this. This is, as many of my colleagues have said, this is long overdue that we treat mental health in just as critical way as we do every other kind of health, because of course they're intricately connected.
Great, thank you. And again, thank you to all the candidates for such a respectful and rich discussion on this important topic. I feel that for one day, mental health wasn't the orphan of Medicare, that it got its due today. Merci très spécial aux traductrices et traducteurs aujourd'hui pour leur travail acharné. Regardless of which party or parties take power on September 20th, you've all given us some hope that there will be concrete action on improving access to mental health services across the country, and Indigenous communities and drug users in particular, I think, can hold out some hope for the proposals they heard today. So I want to turn the floor back to Margaret Eaton, the National CEO of the Canadian Mental Health Association, for some brief concluding remarks.
Thank you so much, Andre, and thank you very much to our panelists who have inspired us today with their passion and their commitment for mental health. We so appreciate your being with us today. Thank you, Andre, for your very skillful moderation and for keeping to our time limits. And I would also like to thank our community partner, Rogers TV, our digital media partner, Daily Hive, for their support of today's event. And thank you to CPAC for live streaming this discussion. I want to remind everybody that change is possible, new thinking is possible, and this election gives us the opportunity to reimagine old ways of doing things and dreaming big about the kind of mental health system that we could have. Let's imagine better mental health for all of us. Thanks everyone for joining us today, and do remember to vote on September 20th. Thank you all, and bye for now.
Thank you, guys.